Today, I wanted to talk about hemophilia. This is a genetic disorder that affects the blood's ability to clot properly. There are two main types of hemophilia, which are hemophilia A and hemophilia B, and they're basically named after the specific clotting factors that are defective or missing in each type. So, hemophilia A is caused by a lack of factor 8, and hemophilia B is caused by a lack of factor 9. There's a related disorder you may have heard of called von Willebrand disease, which involves a deficiency of the von Willebrand coagulation protein. People with hemophilia can experience various symptoms and complications related to bleeding. These can include prolonged bleeding from minor cuts, delayed bleeding after injuries, uncontrolled bleeding after dental work or gum irritation, nosebleeds, GI bleeding, blood in the urine, easy bruising, joint bleeding or hemarthrosis, and neurological signs if bleeding affects nerves. In kids, these symptoms could lead to a diagnosis, while in adults, they may be the first signs of a milder form of the disease that somehow went unnoticed during childhood. The main goals of treating hemophilia are to prevent and manage bleeding episodes. So, this is mainly done with preventative care and replacement therapy using clotting factors to stop bleeding. We're also going to be treating complications related to the disease. Advances in technology and screening have improved the safety of replacement products, and this reduces the risk of bloodborne illnesses. Replacement therapy is the primary treatment for hemophilia, and it may be given before surgeries or dental procedures as a preventative measure. In some mild cases of mild hemophilia A, and also in certain types of von Willebrand disease, there's this medication called desmopressin acetate, abbreviated DDAVP. This medication, DDAVP, stimulates the release of von Willebrand factor and factor 8, which will increase their levels in the blood. It can be administered through IV, sub-Q, or through an intranasal spray. DDAVP has a short lasting effect, so close monitoring and repeated doses may be necessary. So let's talk about some nursing interventions to help patients with hemophilia. First, let's talk about education and patient and family support. We have to provide education to patients and their families about hemophilia, especially when they're newly diagnosed. So, we're going to tell them about their signs, symptoms, and complications, teach them about preventative measures and strategies to minimize bleeding risks. We'll also offer emotional support and resources, such as educational websites, to help them cope with the challenges of living with hemophilia and help them understand their disorder better, basically. Another nursing intervention is bleeding prevention. So we can educate patients on injury prevention, such as avoiding contact sports or using protective equipment. In terms of brushing their teeth, we actually want to encourage the use of soft bristled toothbrushes and to take caution during dental procedures and always inform the dentist of this condition beforehand. In the hospital, we'll promote safe environments and assist with identifying potential bleeding risks in the home or workplace. For medication administration, when the patient comes in, we may help with administering clotting factor replacement therapy as prescribed by the healthcare provider. In terms of wound care, we may provide meticulous wound care for any cuts or injuries because, of course, they are at risk of bleeding profusely. We're going to clean the wound, apply pressure to control bleeding, and dress the wound appropriately. We can also teach patients and caregivers how to perform good wound care at home and when to seek medical attention. We also want to actually help take care of the joints. It's very important to protect the joints from bleeding, so we can encourage range of motion exercises and physical therapy to maintain joint flexibility and strength. We'll also teach patients and families to, again, recognize signs of joint bleeding and when to seek medical intervention. Last, I want to talk about emergency preparedness. We just want to help them understand signs of severe bleeding and when to seek emergency medical care. This is kind of the main theme of the episode is education, education, education. And of course, this goes without saying, but make sure you provide emotional support. It can be really hard to live with this chronic condition. Offer resources for counseling, support groups, and other psychosocial services to address emotional well being. And that is going to wrap up my episode on hemophilia. Thank you so much for listening. I really, really appreciate it. And please feel free to check out my other episodes, such as episode 1, which is all about study techniques and active recall. Thank you. And that is going to wrap up my episode on hemophilia. Thank you so much for listening. I really, really appreciate it. And please feel free to check out my other episodes, such as episode 1, which is all about study techniques and active recall. Thank you.